As Congress began its final debate on sweeping health care legislation, the American Optometric Association's annual Washington conference gave its members a well-timed opportunity. Here was a chance to shape new public policy affecting their profession and the people they serve.
Here in Capitol Hill, we are the patient's advocate. We know more of the issues that they face as patients. We also know the issues they face on their health insurance issues, because we deal with those on a day-to-day basis also.
We have a very simple message. We want to improve America's access to our services. And each year it's the same message. It has some nuance. This year it's more important because there's more at stake.
Representative John Bozeman, the only optometrist in Congress, applauded the doctors and students who made the trip.
I realize, and you realize, that you literally could be legislated in or out of business overnight.
In fact, the AOA's well-orchestrated advocacy strategy was months in the making.
Optometry early on recognized that there was a need for involvement, there was a need for engagement. We had early meetings with the White House staff. From the very beginning, it was clear to us that our message and our agenda needed to be pro-patient and pro-access.
The messengers? Doctors like Dory Carlson, the only eye doctor in Park River, North Dakota, a remote community with 1,500 residents. Her patients trust and rely on her, like the farmer who came in with what he thought was oil in his eye.
It wasn't until I started looking at his eye and I could see the path that the piece of metal had made right through the cornea, through the lens, into the inside of the eye, that I had to do this education process that's saying, you know, this is a little bit more involved than just a drop of oil in your eye.
Across the country, another AOA member, Andrea Thaw, advocates for the tiniest of patients in America's biggest city.
One of our colleagues examined their very first baby under the infancy program and discovered that that baby had a retinoblastoma, a very serious eye cancer that, had it gone undetected, might have killed the child. And that colleague of ours actually saved that child's life by doing an infancy exam.
AOA's efforts to communicate its members' role in providing essential eye care has garnered respect for optometrists in both the public and private sectors. In the Iraq War, optometrists have served a crucial role in caring for injuries that result from IEDs.
Now that we understand the physics of blast and the blast eye, it's about equivalent to 2.5 times the energy that's transmitted from a direct blow to the globe with a punch.
In fact, optometrists are an essential part of the VA's plan for a new Vision Center for Excellence.
There will be optometrists, probably more optometrists than any other specialty represented, because they have been very much involved in the prevention role, research role, low vision.
Throughout the year, AOA made a case for access at every opportunity. And as the time for the historic healthcare vote drew closer, each meeting that these hometown doctors and students had with their members of Congress had a heightened urgency.
Yeah, in eastern Oklahoma, I mean, if somebody had to drive 2 hours to go get their eye exam, there's a bet they're probably not going to go.
Representative Dan Boren, one of optometry's staunchest supporters in Congress, urged AOA members to continue their efforts back home as well.
You don't want to show up the day before a vote and say, hey, by the way, we need your vote, and try to explain the issue. What you want to do is build a lasting relationship. And I know you all are busy, and I know you have lots of patients and all that, but just showing up at a town hall meeting and, you know, throwing out there, hey, just want to let you know we see X number of patients, this is how we contribute.
When the last healthcare overhaul vote was taken, AOA had scored major victories. Included in the final bill was an amendment sponsored by Senator Tom Harkin of Iowa that prohibits discrimination against optometrists.
Healthcare plans, including ERISA plans, can't discriminate against optometrists in terms of participation in the plans. That's a major win. For 30+ years, we faced discrimination among ERISA plans and health plans. That hasn't been good for our patients. It hasn't been good for our members.
AOA had some other notable wins in the final bill. Health insurance exchanges will be state-based. Existing vision coverage will be protected. Children's vision is designated as an essential health benefit. School-based health clinics will now provide vision care. Glasses and contacts are exempt from the new medical device tax, and the cost of vision coverage is exempt from new taxes on high-cost health plans.
The regulations that get passed in healthcare reform are at least as important as the legislation, and that'll determine how our patients are able to access care. It's even more challenging because although the legislation is federal, the establishment of the health insurance exchanges are in all 50 states.
Brooks cautions that hard work and tough battles are still ahead. Some provisions that AOA had supported did not make it into the final bill, including amendments that would have given optometrists expanded recognition in Medicaid, inclusion in key federal health care programs, and an expanded new role in delivering eye health care for infants. And even now, organized medicine is trying to take away AOA's most important win. During debate, the AMA and insurance groups had mounted stiff opposition to the Harkin Amendment. Now, stung by their defeat, the AMA is involved in an organized effort to try to repeal the amendment.
This is why our state affiliates need to stay active and involved. This is why our members need to maintain communications with their state affiliate and with the AOA. And this is why we have to redouble our efforts so that the wins, the important wins that our patients have made in terms of being able to access our care, are not taken away.
There are ongoing opportunities for AOA members to make a difference. Call the Washington office or visit AOA's website to learn more about how to get involved and to plan now for the 2011 AOA Congressional Advocacy Conference scheduled for April 5th and 6th. Ultimately, AOA will continue to measure its success by whether it's able to maintain its prominent position in policy discussions, continue to expand patient access to essential optometric care, and most important, improve the lives of patients all over America. In Washington, this is Nancy Mathis reporting.